In this episode, myself and world-class pediatric PT dive deep into the importance of a team-based approach for kids' health, highlighting how collaboration between pediatric chiropractors and pediatric physical therapists brings big benefits. Whether it's helping kids overcome developmental delay, regain function, or simply thrive, this partnership opens doors to possibilities that single approaches often miss. Tune in to learn why this teamwork and integration between providers isn't just beneficial, but absolutely essential to help our kids thrive. Welcome to the Experience Miracles podcast, where we help parents find hope, answers, and drug-free help to overcome your child's chronic health challenges. I'm your host, Dr. Tony Ebel, and I'll be sharing my experiences as both a dad and a doctor on every episode. I can take the latest science and neurology of healing and break it down in the most simple and relatable way possible. We'll take on the toughest topics and answer your biggest questions through interviews with other amazing parents and leading experts, leaving you with practical action steps that you can take to help your child heal and thrive. It's time to expect and experience miracles. Let's get started. All right, everybody. Today's interview is just one of my very, very, very favorites because I've known this incredible person, this incredible practitioner and pediatric physical therapist for almost 20 years, pretty much as long as I've been here in my community and practicing and taking care of not just any kiddos, but tough, complex neurological kiddos. I have been working alongside this rock star. And I'll just tell you, she has the most amount of heart, the most amount of courage and grit. She is crazy tough, crazy hard charging, and she's just brilliant. And then you put all that together with the long-standing clinical experience. Like, she has seen it all. She has taken care of the toughest of cases. And so this conversation is just going to be wildly impactful for your families, especially in the landscape of neurodevelopment and pediatric development, and how we really work together as an integrated, connected team of practitioners to get kids better, especially in the movement, motor, neurodevelopmental sciences. That's where the two of us really nerd out. That's where the two of us really live. And our teams work together every single day for now probably, I suppose, it's definitely hundreds of cases, if not thousands of cases that we have worked on together over the last nearly 2 decades. So here's the details on Miss Beth. She has been a physical therapist for almost 20 years, graduating from Purdue University with a bachelor's degree in health science, and then from Northwestern University with a doctorate degree in physical therapy. Little Big Ten rivals there, I believe. She is the clinical director at Dream Riders, a incredible non-profit therapeutic center specializing in hippotherapy right here in Crystal Lake, Illinois. She has a heart of gold, and honestly, again, her PT skills go way beyond what you would ever think a pediatric physical therapist would know. She just knows her stuff. I love how she works off script, if you will, to just get results all the time. In her words, she says, "I absolutely love what I do every single day. What I love most is having a part in bettering a child's life. I love getting to celebrate milestones with families that their children achieve after all of the hard work that it takes to get there. Dream Riders brings together two of my favorite things, children and horses. I am so grateful to work with a team of fabulous people and horses that all come together to help these incredible children." Let's get into it. All right, Miss Beth, tell you what, this is a conversation that I probably say this on every podcast, that I am very, very, very excited about, but I'm going to say this with this one. In the best of ways, I'm nervous.
Are you?
Uh-huh. I know. I thought that might confuse you when I say it out loud. I'm nervous because I know this. You have so much good to share, so much insights, and the way you just understand things from your years of experience, which they now know because we went through the bio before we started talking here, and just the depth of the caseload, the toughness and the complexity of the caseload, and now we live this same life together. You doing your expertise and then us doing ours, but more importantly, doing it together for the benefit of these families. And it's wild how the tougher cases you see, actually a lot of times, the more simple you can make it. You have to, right?
Thanks.
And so I'm going to go forward, and then we're going to go backwards, and then we're going to go science-y. And, these guys are with us.
Sounds good.
Yeah, we're going to go over.
Okay.
So when was it conscious at all for you when you began your career as a PT, as taking care of these kiddos and knowing you're going in pediatrics? Did you from the gates, because I don't know this answer, from the gates, did you want to take on tough cases, special needs, complex cases, or was there something that happened that led you down that road that you are now serving at such a high level with?
Well, this is something that I think about sometimes a lot when we send other patients other places that people just don't have the experience with complex cases. So it's not something that happened. It's not something that I planned. I've always been very comfortable with kids. I knew I wanted to be a pediatric physical therapist very early on in undergrad, way before physical therapy school. I knew I wanted to do peds. But I honestly think I've been working at the farm since the beginning of my career, but also working at a private practice clinic. And the combination of the two that I did for so many years, I did early intervention, I worked at the clinic, I worked at the farm. And at the farm, we've always kind of seen kids that are a little more complex. Earlier in the years of Dream Riders, we would see some of the most complex cases because they would come to us as almost a last resort, or they had tried traditional therapy and they just weren't getting anywhere. So they thought to add the horse after the fact. I've worked very hard in the last 20 years to change that, to have people...
To push it upstream.
Yeah, to have people come much sooner than that. But I think that just became comfortable, as well as working at the private practice clinic that I did. I worked along with this group of therapists, and we all worked together. We all grew together as therapists. We were all hired at similar times, and everybody grew together, and we'd all collaborate with each other in multiple disciplines. A lot of our kids doing PT, OT, and speech, and we would all just talk about all of our kids and collaborate with each other. And so I think it became very, just became something that I did, not something that I sought out to do, just something that happened. And then in the last, it's been 4 years or 5 years that we've been doing intensive.
Yeah. So, well, actually, nobody should ever math questions to me. Yeah, sure. Yes.
Okay.
4 to 5.
I think it's been 4 years. Yeah. So, seeing all these kids, it's just, I feel like it's a combination of experience, the amount of time that I've been doing what I do, but also the people that I surround myself with and the other therapists that I work with. I've just kind of evolved that way. And that's kind of what everyone does at Dream Riders. I mean, we always see complex kids. Even my youngest therapist, who's a newer grad, is seeing some of the most complex cases because we just do. Yes. And she's become very comfortable from the get-go. Yes. And it's just what we do.
That is amazing. I want to pull on that thread because that's what I want to actually already add that into an action item for parents that are listening. As a provider, taking on complex cases alone is impossible. I'm just going to state it very clearly like that. Yeah. Taking on, and I'm going to be over the top with that statement just to really bring it home because they're complex. And so you can really get lost in the weeds really, really quickly with the intricacies and the difficulties and that their nervous systems go through. And so the power of a team, the power of a collaborative team, we have grown together. We're going to go there next with our story. You have made me tremendously better at the work that we do chiropractically because of the conversations with you and your team. And so parents, do that together. And I know this already innately comes to parents. That's what I love, especially about special needs and complex cases. Parents, whether they're consciously doing it or not, they are really rallying to bring a team together. Absolutely. And they want us communicating and collaborating. And so that's a take home right out of the gates. Like, make sure
everybody does that.
No, they don't. And that's why I was going to double tap on it. Like, go ahead and demand that of your provider, by the way. Like, we will voice text each other. You'll be getting adjusted, not even by me, by someone else. And I'll pop in the room and slow you guys down and make Connor, your son, roll his eyes because he's like, Tony just shopped in the room. They're going to talk about these two kids. I'm going to be here 50. Connor's her son.
I'm going to sit in the car.
He's also getting adjusted. He's like, I want to get to baseball. And so we talk. And through talking, through community, through collaboration, we've grown together. So parents, stay active in those communities and make sure that your providers work in that. In fact, I can give you a real great lesson of that. When our intensives come, which is what we're going to talk a ton about on this interview right here. When the intensives come, Dr. Matt does a ton too, but I do this podcast. My name's on it. I do a lot of the videos and my name's on the Facebook page. And so when people come here for care, what they think is best for their child is if I was to take care of them every single visit, every single time. And let me say right out of the gates, that would actually be a limiting benefit.
Absolutely.
Because that would only be one brain, 2 eyes, 2 ears looking into it. At PwC, there's 8 of us. And with you, there's your whole team, and we're working together. And the magic, and I know I'm belaboring this point intentionally, the magic is in the community. So let's go back to the clinic.
Okay.
So you guys, that is, because this is the funny thing, like we're finally slowing down to do this podcast. That's where I first met you guys. I came into the more, can we call it standard for now?
Yep.
And then we'll describe Dream
private
Riders.
practice,
Private
standard
practice.
clinic. Yep. Pediatric only clinic.
So go ahead and let them, I'm just going to, an open-ended question. What were you thinking when I got done with the perfect storm? We hung a sheet on the wall?
We did. We hung a sheet.
I brought a
over the
projector
mirror,
in.
and he brought a projector, and we all had lunch, and we were sitting on the floor, and he did his probably very first perfect storm.
It had to be one of the first or second
practice.
So what did you? So I don't want to know what you guys said while I was there. I want to know what you said after I left, because you are a close knit crew of professionals. Yeah. Chiropractic to most people, just like to most parents, is cracking backs and spinal problems, and chiropractors are crazy. So I'm
crazy,
sure.
But I thought you were just crazy, like excited and just ready to go, and you talked a million miles a minute, and I don't know that I understood half of what you said. I wasn't receiving chiropractic care myself back then. I had, as a physical therapist, for some really strange reason in school, we learned not good things about chiropractic in general, which I think is just
and then chiropractic, weirdly, for no reason at all, has this bad taste in their mouth about physical therapy. And it's like, man, we're missing. They don't
understand how much we can work together instead of like, I can do everything. I cannot do everything.
Right.
And if we work together, it's so much better. And I think so back then, which I think we figured out was 2008, which is crazy.
Wild.
It's crazy. Totally thought he was nuts, for sure. But I knew he was passionate. I knew he was excited. I knew he had this practice that was just exploding and close by where we were. So through those years, I had a lot of patients that came to see you. We had therapists that had come to see you. Their families had come to see you. We had one therapist who had a son that very early on saw you and had incredible results. So we knew what you were doing was amazing and impactful. I just hadn't experienced it myself.
So let's break down some of those cases. And for now, let's go ahead and generalize, kind of like group some cohorts together of patients. And then I think today, let's go ahead and get into a couple of case studies. Sure. Obviously, we'll leave the names, clear, but we'll get even more granular. So even in the early years, let's say you guys had these kiddos under care with traditional therapy. And I'm going to put it that way for now, just for contrast. With traditional therapy, they were not getting adjusted. So you already had these kids under care. You were able to measure their progress, work with them, do everything you could to move them forward. Then they start getting adjusted. So now the combination, your guys' therapy plus neurologically-focused chiropractic would kick in. What differences did you see from the kids who also had chiropractic versus the kids who didn't? And still
I think
today,
that's very different back then than what it is now, for sure. Because I think I'm so much more aware now of those the differences, and I know they're so necessary in my care with my patients now. So I think if I have to really think about, I can only think of a couple off the top of my head, but one was a little guy who at 6 months old, mom was very concerned about him. She was very concerned that he would be on the autism spectrum. She was convinced, and we all told her that just because you see these kids every day does not mean that that's what is going to be going on with your child. But she was very convinced, and she started speech therapy. I saw him. He had OT, and then she came to you, and she changed his diet. She did not do vaccinations. She got him adjusted, I think, at least 3 times a week. And lo and behold, but by the time he was 12 months old, he was crawling and walking and learning to, he was talking, and he was still in therapies, but he was just exploding in all areas and doing really well. And he's He's a very bright young man, but he's thriving in life. Yeah. But it started so young. I mean, she started at 6 months old.
It's a dream sort of scenario. Yeah.
Yes, but back when we didn't,
that was unheard of. It's still less heard of than we'd like it to be. You know, like
that
you guys,
14 years ago.
Dream Riders and PWC have been built on this context of welcome to the last resort, and we've been working our tails off together to be at least like, can we be second to last resort and then third to last resort? And you know, how's this working?
So long on that. And I think we've gotten there. I definitely see a lot more babies.
Massively.
A lot more babies.
Yeah. Even coming from out of state, you know. Yeah, we are getting to start earlier than ever.
But I think that case was so early on. It was definitely eye-opening back then. And you know, I started chiropractic care, but
let's go here for a second, and then we're going to come to you and Connor. But so actually get into the weeds with it. When you are in session with a kiddo and they are getting adjusted, so you know, like, let's even play it out. They come to PWC, they get adjusted, they get their nervous system calmed, regulated, balanced, more efficient. A bunch of words we can come in. When we get in the science section, we'll bring those words to life. Sure. But that's what our kind of adjustments do. Well, the goal of that in this combination, collaborative care, is to set the table for you to get even more out of a therapy session, not just you with physical therapy, but the same would go for OT, speech, and everything else. Yeah. What does that look like in that 30 to 60 minutes for a kiddo who is well adjusted and their nervous system is balanced versus a kiddo who is, and I don't love this versus, but it's important for parents to hear this.
I think I have a good understanding of that, and where that started is that the horse, not the same thing, but the horse does something similar. So very early in my career, I understood by having the magic of the horse's movement regulates the sensory system, helps prime that nervous system so that when we teach them skills in the second half an hour, they learn them faster and retain them better. They're in a ready state. Their nervous system is calm and ready, and they're ready to learn. And that's always been something that I've had that ability to do that because of the horse, and there's a lot of other things that go into it, but because of the horse. So now you add in chiropractic to that, right? So now these kids are well adjusted in addition, and not every kiddo goes on the horse, right. But say they are well adjusted and then they go on the horse and then they get therapy. These kids are just ready to learn, and I don't want to call it results because I don't like to say that we get results, but basically our kids are thriving so much more when they have that collaboration. And we've played around a little bit with our kids on where the timing of that, because PWC is only 6 minutes down the road. Yeah. So if they go get adjusted and then they come to the farm and they ride the horse and then they do therapy, it's like magic, right? Yeah. Or if you just happen to be at Dream Riders, it's really great.
You saying if I happen to get on time to pick my own kid up from Dream Riders, or should we go ahead and admit that on the podcast that I was a smooth 28 minutes late to pick up Elena last week? It was the week before school. There were so many appointments.
Yeah, Dr. Matt beat you there.
He did beat me there. There's a whole community of people that know my kid there, and this is my most sarcastic social butterfly kid ever. So I couldn't have left a better kid, you know, at a better place.
So, not all of our kids do that. It's not always in that order. It depends on what their care plan is and depends on when they're on our schedule. But if they are receiving chiropractic care and we're seeing them, I just find that they're ready to learn. And if they have a calm nervous system then
makes all the difference in the world.
Yeah, their brains can learn.
Their brains.
You got to not learn.
No, you have to. There's a phrase that's been on the bottom of our post. So our gas versus brake pedal poster is the real kind of imagery of the perfect storm neurology, and all the podcasts talk about this. When a child goes through the perfect storm, they get stuck into this subluxated state, which means sympathetic dominance. So the gas pedal gets stuck on. Well, when you have the gas pedal stuck on, fight or flight, you're in protection, you're wound up, you're shut down. When you're wound up, you're shut down neurologically. So there's this phrase at the bottom from Dr. Bruce Lipton that says you can't be in growth and protection at the same time. Well, therapy needs a kiddo in a ready state, a growth state, a calm, connected, open pathway state. Chiropractic, this kind of chiropractic, neurologically focused chiropractic, is entire design is to make adjustments that bring that child to that neurological ready state. calm, regulated, open. So I want you to go deep there. Let's go. Nerd hat on, homie. What does the horse do and what does ready state mean for these parents? Because the horse is, that first 30 minutes is designed to set the tone and get them into ready state. So how does the horse do that? How does the horse help with that? And define ready state even a little bit more from your lens.
Okay. So the horse's movement mimics the human gait pattern, forward, back, side to side rotation. I like to say it's times 2 flipped 90 degrees. All the research is only done on the hindquarters of the horse. So it only talks about the pelvis. The horse's pelvis is the same as a human's pelvis, flipped 90 degrees. So if the rider is sitting up forward, which I can get into that most of our kids do not sit forward. But if they are sitting forward, I think this is a good explanation. If the horse's movement is more lateral, the human's movement is going to be rotational. If the horse's movement is more rotational, the human's movement is going to be lateral. So lateral movement is very calming. Rotational movement is more excitatory. So if you have a kiddo who is more high-strung, raging bull, as you call it, you would want to put him on a horse that would create lateral movement so that you could calm their body down. If you have a child that's low tone, low arousal, and needs you in your session, you normally would be having them run around and jump and do all these things to get as much input as they can to get their body in a ready state the other direction. You would put them on a horse that creates more rotational movement to give them that while they're on the horse. So we see that while, after we put these kids on the horse for 30 minutes, sometimes we do a few activities while they're on the horse. Sometimes we do interact with them while they're on the horse, depending on what their goals are.
And sometimes you don't, right? Sometimes you're just...
Sometimes the whole goal of the horse is to create that ready state. Totally. To get that child in a ready state so that they can learn. And that second 30 minutes is so much more impactful if they're in that ready state.
You can do more in that 30 minutes than you could have done in 3 hours without doing the ready state.
Absolutely. And I saw that in the traditional clinic. Cool. I worked in both places at the same time. I would see such different results. Not to say that a traditional clinic is not okay, but it's just different. You have, I have that tool to be able to use with our kids, and it's so important. And I think our program is so big, and it's like we do so much more because we've been doing this for so long. Like what we do, we're seeing 175 kids a week right now. So that's not all of them go on the horse, but like we have a program, and like what we do is very like methodical with these kids. All of our therapists know how to use these horses. We see what their movement is. We get on them. We know, and we pair the right horse with the right kiddo. And some of its personality, some of the horses.
So true.
It is. We know all of our horses' personality. Some it's just not a good match personality wise. Like,
so is the flow chart of analysis gait pattern first, personality second, and then you have to match it up.
Well, it's all on our sheet.
If anybody works with horses, you actually know how bloody true that is.
Sure, and some horses tolerate certain things. Yeah. Some of them don't. Some of them don't tolerate kids making a lot of noise. Some of them don't tolerate kids moving a lot when they move. And we put kids in different positions. We use prone over barrel inverted, where they lay on the horse on their tummy a little bit inverted, so they get a lot of vestibular input. They have to be pretty little for that. We put them in what we call PFR, prone facing rump, where they're like on their tummy facing the back of the horse, and they get a ton of input from the hindquarters of the horse. I believe that there's input from the front of the horse as well. It's just not what the research is.
Yeah, it's just not. It's not as documented as
it's just not.
But that's okay. When you do what we do, you are documenting it by taking care of kids and getting results, and then eventually somebody will slow down. We won't, but somebody else will slow down.
And then we sit kids up backwards. Yeah. So the way that the horse's back is, where their withers are, which is that little hump on the front of their back, basically. If that makes sense. That basically, when you're sitting forward on a horse, it kind of facilitates posterior pelvic tilt. So you're sitting like this. So you have to be really strong to sit up tall on a horse and maintain balance. It's really, really hard. So most of our kids cannot do that. Yeah. Some of them can, but most of them cannot.
So what a great milestone in the midst of therapy to know that you can move into these different positions and not just tolerate, but
sort of. I don't necessarily like to tell parents that though, because they think their kid is making progress if they're moving positions. but a different position might be helping them more.
Yeah.
I don't want a kid that sits up they have the least surface area of their body in contact with the horse. So if you're really trying to maximize sensory input from the horse, it's not in sitting.
Wow.
It's never going to be in sitting. So not that we put super tall kids.
There's just less touch, less contact
with the horse. So it's not a progression necessarily. It's definitely a care plan. It's really thought about in each child and what their needs are.
Okay. So the way God made my brain is to be able to go so far down into the nitty-gritty details of neurology and granularity of it, and then simultaneously try to just simplify the heck out of it, right? And we need to do it for ourselves to put the best care plan for kids, and then to communicate it to parents. I know right now, because you did this to us many, many years ago, when you taught us about that different horses have either a lateral or a rotational gait pattern,
or anterior posterior, or that, up and down even. Yep. Some of them have a very choppy gait where you get that percussive input.
But what blew our mind is this, and right now I know when you said that, because I know that way the podcast listenership goes, we have a ton of other practitioners, we have PTs, OTs, and a ton of pediatric chiropractors that listen, and I know my neurologically focused chiropractors, all the nerds out there, literally pulled their car over, grabbed a notebook, and were like, she's speaking our language. Every time we put you in front of chiropractors, their minds are blown, because you're like, wait a minute, I thought you said she was a doctor of physical therapy. I was like, I did say that. And they're like, well, she's talking like a chiropractor. And here's why. Because that nuance of a lateral, what we would call subluxation pattern, versus a rotational subluxation pattern in our world, like for instance, we call rotational, and actually a lot of parents under our care right now are going to identify this. And those of you that haven't started yet, you'll go in, you'll get your scans, you'll see your PX doctor, and you're going to hear this language that we are talking about on this episode. You're going to see it come to life in your child, and get excited, because when we find this, we can adjust this, we can handle this with the right horse, the right care plan, the right therapy, and it makes all the difference in the world. So I'm going deep into the weeds for a very intentional reason. So rotational in our world is what we call a counter torque pattern. And when a child has a real asymmetrical counter torque subluxation pattern, they are filled with tension. They are filled with irritation and agitation. And so they come out as a raging bull, right? They actually, seizures live in this very, very, very sort of state. So we need to address that by getting less of that in there. So you need to adjust in a way that gets that stuck pattern out of there. And same the other way. So there's certain techniques. So I'll put a bow on it with this. Just like you've identified, this is the detail that I love of your guys' work. You know which tool of the horses and their gaits, including the position of the child and what you know what is going to get max benefit based upon what that individual personalized child needs. We do the same with our adjusting techniques. Most PTs, every kid gets the same thing. Most chiros, every kid gets this. I kind of threw you guys under the bus there. In a very standard cookie cutter approach, doesn't matter the initials, that every patient gets the same technique. Well, if you happen to luck out and you're the patient that matches that technique, voila, you get results. But others don't. And so that never sat well with you. That never sat well with me. We're here to try and shoot for, we'll use a baseball term, not a basketball term, since you got a baseball player in Connor. We look to bat 1,000. What a crazy goal, right? To go forward. But you get into the details and say, got to work on it this way.
Those kids that have those rotational subluxations, they need lateral movement for calming, that's pretty amazing. So then there's a lot of kids that I work with that after they get adjusted, they need rotational movement to engage their core and disassociate.
Because they were so off track.
Head on trunk and trunk on pelvis, because they can't move. They move only laterally.
It's wild.
So,
and you taught me to pick this up. Like I never used chiropractors are trained to do their analysis. We have our scans and we have our hands. Nobody ever trained us to use our eyes. They didn't. You really, when we said earlier that you really helped me when I said you helped me do my job better, I didn't know to look for that stuff until the child got on the table. What an absolute mistake, because what most of our perfect stormers are and everybody listening, even if your child, according to the pediatrician's chart of developmental milestones, let's isolate gross motor for this next section. If they can walk, they can run, they can do whatever. Yeah, they check the box. But when we put our eyes on them,
how are they doing it?
Are they rotational or are they lateral? Are they a raging bull? Are they a drunken bull?
Yeah.
And so we assess that neuromotor movement pattern. And so let's just go deep there. When it comes to fixing one thing at a time, which was kind of our preamble before we started recording, why does the sequence of neurodevelopment, first off, let me go backwards. What is the sequence of neurodevelopment as it's supposed to go optimally?
Motor milestones?
Yeah.
Okay.
And then why is it so important for the brain and the body to do these things one at a time? And that's hard in our work because as a parent, you want to get to the downstream stuff yesterday, but we've got to fix the foundational stuff first. So what are those milestones? Why are they so important in sequence one at a time?
So rolling, sitting, crawling, walking, running, jumping, climbing, higher level coordination and balance.
Yep.
Like moving through the sequence of gross motor development. What are you're asking? Why is it so important?
So this is so. Sorry. I do this.
Like,
this
I don't know
one, yeah. So because here's why I'm asking this question. We see so many patients who have seizures, brain-based problem, speech delays, brain-based problem, anxiety, ADHD. Now, I'm isolating as a brain-based problem because that's what other professionals are telling them it is. What we know is that the brain works for the body and does what the body tells it to do. So if the body is giving it bad information, the brain is going to make a bad decision. Right. I think that might be the most short and succent I've ever said that in my life.
That was really good.
We should clip that part. Because I don't know that I can ever say it that succinctly again.
I'm impressed.
And so we have parents that are looking for improvements in advanced brain function.
Okay.
On a medical exam, they would go, oh, that's a prefrontal cortex thing. They would go, that's a parietal cortex thing. That's an amygdala thing. That's a hippocampus thing. That's a cerebellum thing. And we would go, that's a gross motor thing. We would go, that's a body thing.
That's a body
And
thing.
so why is gross motor so important?
If their brain isn't functioning.
And so I don't want to say we don't worry about speech and seizures, but we don't worry about it first. We can't focus on it first because we evaluate our kiddos and their central nervous system, their autonomic nervous system, their neurospinal system, and their gross motor system is a mess. And nobody has told the parents the truth that, okay, your child checked the box on the milestones or they were delayed and seem caught up. They're not. They're still a mess. Oh, yeah. So why is gross motor so important for the body to get done first before fine motor, speech, socialization, and so forth?
I don't know if I know the answer to that question. I don't know that it's, I think that gross motor is something that a kid is going, if they have the tools, if they have the ability to do it, they're going to learn to move their body. Whether they move their body correctly or not is dependent on their brain and dependent on how their nervous system is functioning and how they're learning. They're going to learn to move. They're going to try to throw their body into movement because it's just something that is basically innate. We need to move our body. Like,
will it
as
force
humans,
compensate?
Absolutely, it will force compensate. So you sometimes, dependent on when I start with a kiddo, I see compensations all of the time and have to fix them after the fact. So absolutely, if a kid comes to me with a that's already walking, that's already learned to walk, and their gait pattern is all over the place. Typically, it's something else going on, or there's coordination, or they're not using their core, or whatever it is. That happens all of the time. I see tons of kids that just aren't using their core. They just shut it off because they've learned to move in any other way. And if they're not using their muscles optimally, all muscles work at an optimal length tension relationship. So if you're not able to use your muscle at this optimal length tension relationship, you're going to use it anyway. So kids, like, they don't know anything's wrong. They're going to move their body. They have no idea that, like an adult has an injury and they can't move the way that they move. They know why. They know there's something going on. They know something happened. But a kiddo, like, nothing necessarily happened. I mean, definitely that happens sometimes. But if they're just going through development and they're learning, if their brain and their body isn't in that ready state, they're going to learn anyway. They just might not learn the right way to move, not the right way to do it, or not the right way to use their muscles, or not the most optimal way to use their muscles. So gross motor, I think, is just something that it just happens. And it can be forced too. I mean, I can physically move a child's body.
That's what I was going to ask you next. Is there some times where, because let's say a child has delayed
the only
motor,
thing that can be forced.
Totally. You cannot
force a kid to talk.
You can't force it. No, that's a great point. That's actually, I've never thought of it that way, but that is so true. You actually can, through different means, you can kind of force gross motor development. And let's be honest, it kind of happens from both a parent standpoint and a provider standpoint, because it's like, we all know enough about milestones and brain development to go, well, if they don't do these things on time, isn't that a real big deal for their brain?
My favorite one is my kid was so smart they didn't crawl. Just went right to walking.
Yeah. They're gonna be in the Olympics, right? And well, they're gonna run in a very rotational, inefficient pattern. So maybe the track will work. Okay, that's a bad joke, but I've thought about it before.
Yeah.
So
we could talk about that for a long time.
Totally. So so these compensation. So here's the words that we always communicate with parents about this: compensatory patterns. So compensation of gross motor creates confusion to the brain.
Absolutely.
That it creates an inefficiency.
That body to brain connection is.
So when you have gross motor function happening, but you have it in a very inefficient, disorganized state, you absolutely automatically, positively have an inefficient, disorganized brain. Now, what that looks like is sensory processing disorder, focus and concentration issues, emotional behavioral regulation challenges, cognition, right? Cognitive developmental delays, social emotional imbalances. And if the brain gets ticked off enough, what I find is the majority of our seizure patients have real significant asymmetric rotational patterns. So these counter torque, and that combination of subluxation, which sets in first, which leads to the compensation, which creates the confusion. So here's the math. And we know we're on a podcast and us two nerds are giving you a lot of information.
I like that.
But when you have subluxation, you have a stressed out, wound up, ticked off nervous system. Yep. When you have compensation, now you have a confused, discombobulated, inefficient brain and nervous system. The combination of the two, both of them on their own, not good. Both of them together in sequence, really not good. So what we do, and here's where you're going to be able to pick this up and run with it, when we're clearing out subluxation, and I know this is where when you see chiro kids under your care,
they don't make sense.
You knew where I was going.
They don't make sense.
When we clear subluxation, their body starts to compensate differently, which is awesome. So a lot of times parents hear us on this. Healing, it is anything but linear, and it often has to go backwards to go forward.
Absolutely.
We will see some of our kiddos who, their parents had no clue how much these gross motor. So what does gross motor mean? Running, balance, coordination. Your child might have forced their way into that, and you're just so used to seeing how they do it. Just like when a kiddo is kind of like their speech isn't clear, but the parents can pick up on it and others can't. Yeah. We pick up when your kiddo has gross motor inefficiencies, whereas you probably don't. And so what'll happen, we'll have a kiddo who's actually kind of getting along okay, and we start to adjust them, and they look like, 1:30 a.m. college bar. Okay, I'll give you that analogy, right? Like people just slurp,
right.
All of a sudden they're all over the place.
Compensatory patterns come out,
and we get excited. Because now we're getting to more of a fresh slate to get them better. So can you speak for a second? I kind of took us down this road, so let's go there. When a child, why isn't this neurological healing, especially through the movement-based sciences that we work in together, why is it not linear? And what can you share? What do you communicate to parents when maybe they're in a bit of a sideways or in a bit of a plateau? What do you communicate? And then we'll go into it together. Like, okay, what do we do in those sort of situations, right? Sure. But how do you communicate that to parents?
Well, I think sometimes parents get frustrated when they're seeing progress and then they see plateau, or development is not linear at all, and everything affects development. So a child is affected by so many things. They're affected by growth spurts and teething and environment and changes in environment, stress. For stress, you wouldn't think your child is stressed out, but stress in any way from them being sick, those kinds of things. But all of that affects their development. But I think, I talk about this sequence of development in gross motor alone. It doesn't necessarily have to be a sequence. You just want them to meet all of those milestones, or to move through development that way. And not all kids do, but if they don't, then we want to back up and kind of hit those milestones.
You got to go back. You got to rewind. This might outdate some of you parents, right? But you got to rewind the VCR. You got to go back and say, okay, well, you skipped this stage, or you skipped most of it.
The body is designed to be able to do all of those things, and to a child's body, is designed to grow and develop in that way, and to develop. There's a reason why kids crawl. I mean, it's the only time in your life that you are consistently weight bearing on your hands for fine motor skills. It's the only time that you're using your back muscles completely against gravity. The only time in life that not the only time, but you're using both sides of your brain at the same time when you're crawling. And it's just such an important milestone. And so many kids skip that. So if they skip that, go back to it, crawl all over the house, crawl over the pillows, crawl over all over the place, because there's so many things that come from that one gross motor skill that follows through development.
For sure.
And that's just one example.
It's perfect. It's perfect. So we just want to, I'm so glad we got to go there, because it can really be, parents, you don't have this, we're looking to do it with this platform, this podcast, our articles. We have tons of articles. We're working on really cool infographics to show motor milestones. And again, not just in the standard kind of miss it unless it's grossly apparently obvious way that exists in a conventional pediatrician's office. But we're really, really working on being able to show this to you in the way we're talking about here.
Quality of movement is so important.
Efficiency. It really.
And it affects these kids. Like, not every child is going to be a D1 athlete. We all know there's so many more things that go into that. But we want to set up our kids for success to be able to move their bodies in whichever way they choose to. So I'm going to make sure that if a child does want to be an athlete, they have the ability to do that if they want to put in the work and become an athlete. And, there's always genetics involved in your ability to do that too, for sure. But we all want to set our kids up for success to be able to do whatever they choose to do in life, and to no matter what their abilities are, disabilities are, and to be successful and functional. And we all want that for our kids, and no matter what. And so, if we can provide that, gross motor is just a very small piece of what we're doing with our kids' development, but if we can have a part in that, then we're doing something.
1,000%.
Right.
Honestly, just because the neurology is so the same. If you want your child to be a mathlete, if you want your child to get an academic scholarship, their motor patterns, this is actually one of the biggest things we face with and when I say, with our science-loving nerds, I can't even tell you how much I say that with affection, because you're talking about Captain neurophysiology, molecular. My undergrad major was genetics and molecular biology, and then that wasn't nerdy enough, so then I switched to physiology and neurology. So, when I say that those things are important, one of the biggest things we face is these hard-driven academic kiddos that really these kiddos that want to innovate and create and program and do all this, they will actually run out of brain power, not just emotionally, but also, and they'll start to struggle cognitively around their junior, senior year of high school, if not college, because they get so in the books. Literally, they stop moving. And I'm telling you, this is how freaking simple this is. You can hear me getting excited because I don't give a crap what a kid wants to do, whether they want to be a world-renowned bowler, chef, or, or molecular biologist. Yeah. I'm telling every kid under our care of every age, little ones and big ones, you need to move. And not only do you need to move efficiently. You need quality. That's what really struck me there. You need to move with quality and efficiency. Do you need to CrossFit or marathon run or go to frickin' Pure Barre or whatever it is? No, but you need to do something. And the more you want your brain to work for you, the more you need to do it. It is your absolute cheat code to not just athletic performance, but mental, emotional performance. You want your child who is struggling mentally, emotionally to get better. And parents right now, let me stay on this for just a frame. I know what you're thinking, like, well, I tell my kid that all the time, but they won't go outside. You know what? Once a child is subluxated and sympathetic dominant enough, they end up reaching what is called neurological exhaustion. And they know too that they should go move. They know too that they shouldn't have Rockstar energy drinks and Kraft mac and cheese. So right now, wellness parents, because I know who listens to this podcast, you're thinking, see, kid, I told you should go outside. I told you should go. Dr. Tony says it. Beth say it too.
Go move your body.
Go move your body. But a lot of times they need to get adjusted first, actually sometimes for weeks to months, to even have enough efficiency and energy in their neuromotor, in their nervous system to get up and get going. So, okay, so that was a big rant there. So when a kiddo is in a plateau, what we do have some levers that we can pull. If you have a patient who's in a plateau, what is your brain strategically thinking with the care that we collaboratively, that's a tough word, provide? How do we break through plateaus?
Are you going to PWC?
It is kind of
my first question.
It's a plateau breaker for sure.
Then collaborate, like talking to you. Yeah, I mean, sometimes it's difficult. Sometimes it's more about just communicating with the family about like, it's okay. It's okay that this week these things are going on, having those conversations, asking those questions, what else is going on this week? And how how that could be affecting that child. But in the same time, we're repeating over and over again those same, whatever it is, the activity that we're working on, whatever movement we're working on, whatever milestone we're working on, whatever, we're repeating it through that process and continuing to work on it, knowing that once they get through that storm, once they get through whatever they're going through, then they're going to be ready to learn that skill. Yeah. So I just, in my sessions, I just would continue to work on those things, but having those conversations and then collaborating with you guys on, what you're seeing, maybe asking them to get a scan so we can see where they're at right now. It's all about communication. It's all about, keeping that relationship between me and the family and PWC and just making sure that we're all on the same page and we're all having those conversations. I don't want the parents ever to feel like they're frustrated because their kid is plateauing when you can just have a quick conversation and ask what else is going on right now. And those are the reasons, those are definitely the reasons. And what more can we be doing right now to help them through that? I mean, in my world, we might change their horse. If they're plateauing, we might change that input that they're getting. We might dig deep into what's going on in their nervous system right now, what's going on in their sensory system right now, because those things change all of the time. So if we're using the same horse all the time and using the same position all the time, then that might need to change. And then, what we're working on right now is too difficult. We might want to change what we're working on. We might be something different. That
is us. That is what, anytime we run into a plateau, the first place we look, okay, well, this is communication. That's the word I wrote down here. And it sounds like, it's like such a simple one, but guys, we're all so busy, parents, providers, we need to have, and we're over the top with this because it helps us get results. We ask tons and tons of questions. I every day in my practice, I can tell I ask questions. And when I ask it, parents are like, oh, geez. I didn't know. Because other doctors don't. I did.
Parents know.
They do.
They always know. They always really know the reason. Like a parent knows their child better than anyone. They just don't know it until they say it out loud. And if you ask the right question, then you're gonna get them to understand. And then as parents, we're always worried about our kids from the time that you find out you're pregnant. You're worried as a mom, especially. You're worried. You're always worried about something. It just changes what you worry about as they get older. So, as a parent, you have this barrier to really knowing what you do know is your worry. You're stressed too. You're worried about something. So if we can just have those conversations and get them to say it out loud, what it is else that's going on, then the worry kind of goes away.
It's wild. I know this is just going to be one section of this awesome conversation, but man, I hope parents hear this one. Always ask the questions. Ask your PX doctor, ask your therapy team, because the truth is you do know. It's the thing I'll say on every podcast episode. You and I know neuroscience and neurodevelopment. In fact, you know it so well. When I ask you to dig into it, it's a little funky because you're like, well, I just kind of do this stuff. Long ago we studied it. Now we just do it.
Right.
Well, as a parent, you're just parenting.
That's because we're getting old.
Yeah, that too. But as a parent, you're just absolutely doing it. And you're like, well, I worry about it in my own brain 24/7. They don't want to know this stuff, do they? OMG, we need to know it all. You're always right. And if other doctors tell you the opposite, they're wrong. The truth is you have the answers we need. So when a kiddo is plateaued or regressing or going through it, we first dig into life. Like, tell us what's going on. And not surface level. Give us the deets, the good, the bad, everything in between. And then we can make sense of that. Now, a lot of times, there isn't. A lot of times, maybe if there isn't teething and there isn't a cold and there isn't a fever and there isn't a growth spurt, awesome. By the way, good news. Well, now that allows us to look inward. And in your world, I'm going to change the horse. I'm going to change the position. We're going to change kind of the flow with which we're working on skills. Yep. In our world as chiropractors, what we have is we can change frequency. So we can go go up or down in visits per week. Usually if a kiddo is stuck, we have to go up. We can change our technique. We can actually, because chiropractic has over 100 different techniques. Most chiropractors really just limit themselves to one. You need to see a PX doctor who is trained in a multitude of techniques because every kid is different. And not only are they different starting out, the whole goal is to make them different. So you actually have to update they change. And so we can change. Yeah, totally.
That's what we want.
If you don't see change, well, then we change. We change our frequency, we change our technique. And then in our world too, there's what's called primary subluxations where you're adjusting. They're called patterns. And again, a little bit beyond what a parent ever needs to know, but you need to ask the question of the doc. And then I know docs are listening, so I'm just going to go there for a second. Docs, when you hang out with me in the practice, I don't talk. I always make this joke. It's such a bad joke, but I promised people on this podcast I would continue to bring out the bad jokes. So Connor will roll his eyes if he listens to this one. But we're in Chicago. We do not need to talk about the weather, the politics, or the sports because they all suck. Okay? And so it's a good joke. I'm not actually from Chicago originally.
I would agree with two of those.
Yeah, I know. I can throw. Yeah, and the weather right now is actually good, so that doesn't work.
Right.
But
it's beautiful.
The joke of that is when I come into the room, I'm asking 100% of my questions are about your child's health, right? And 100% of the information I'm taking in is about processing that. And so sometimes I'll get done and I'll be like, oh, I probably wasn't too chatty about anything other than the nervous system and the vagus nerve and gross motor and proprioception. But you know what? That's what parents really, really need. Okay. Couple of questions here around third base. We're sticking with baseball analogies for your boy here. Okay. Let's go there. Connor.
Sure.
Taking you out to left field here. Connor's story. What did Connor struggle with? And in your words, in your mom experience, I know you can put it through your professional experience.
Hat.
Yeah, your mom hat.
Sure.
What was Connor struggling with? And then how did getting him this kind of chiropractic care change his life? And where is he now? Take us through Connor's story.
Connor was under chiropractic care from the time that I was pregnant with him at another chiropractor's office. Not very regularly, but at least whenever he was with me when I would go, he would get adjusted. But when he was 6 years old, he just got sick out of nowhere. He ended up spiking a fever, and the fever lasted 5 days. And it was so bizarre because he just was lethargic and cranky. And Connor is a very high energy, very all in kid. Like he's like in your face all the time. And he just was not himself, and he just did not feel good at all. He was not himself. He was running this fever, and it would come and go. And I took him to the pediatrician, and the pediatrician didn't know what was wrong with him. So he sent us to an infectious disease doctor, which was so scary, of course, got us in right away. And this lady ran some blood work and called and diagnosed him with CMV virus. So she told me he had this virus. It was like mono, so it was going to last a while, but it wasn't mono. And so it's like a mono-like virus, I guess.
In the
CMV
same category.
In the same category. And that he would be, after a few weeks, he should start to get better. And over those few weeks, I had taken him to the chiropractor I was seeing. He couldn't figure out what was wrong with him. Then his knee swelled up, and I panicked, of course, and got him in to see an orthopedic specialist, a pediatric orthopedic doctor in Rockford. And he was the first guy to say he thought maybe it was Lyme. And so we called the infectious disease doctor when we were there, and and she was like, no, we tested him for Lyme, or we did not test him for Lyme because he didn't hit all the markers of Lyme. So it was CMV, and that's what it was. But if he wanted to, he could drain the fluid off of his knee and test the fluid. And he tested the fluid, and the fluid came back negative for Lyme. So then we went back to a different infectious disease doctor, and she didn't know what was wrong with him, said it was still CMV, but it was lasting a really long time. And then they suggested we go see a rheumatologist. And that's when I freaked out because we have autoimmune in our family.
So you're on your fourth doctor by this point with no answers
yet. Fifth doctor with pediatrician. It was crazy.
Told you I wasn't good at
no
math.
answers, yeah. And so when they called and recommended that we go see a rheumatologist, I called Dr. Tony. I called and I think I called you directly because that we were we were
working
working together. We were collaborating on some, because we were trying really hard in this community to do what we're doing now, which is pretty cool. But
it is.
So I called you directly and you said, bring him in. And we started a care plan. He was being adjusted 3 times a week. And we saw some improvements, but he still just wasn't himself. And we finally had the appointment with a rheumatologist. And this was about 9 weeks after he started being sick. And then almost a week later, they did a bunch of blood work. She said if it was autoimmune, it wasn't bad enough to be an autoimmune disease yet. I said, yet, right? And just ran some blood work. We got a call back from the infectious disease doctor like a week later. And she said, yeah, he has Lyme. Here's 28 days of amoxicillin. Come back if it's not better. I was like, oh, okay. So from 3 weeks, it was 3 weeks in when he was sick, was when I called Dr. Tony and we started care. And then it was 7 weeks later that he finally got the diagnosis and started antibiotics. And he fully recovered. I mean, literally within 24 hours, he was better. Yeah. But because he had been adjusted from 3 weeks on, he recovered.
It was
fully.
insane because he was making, I remember the details of his case being, it was a slow moving recovery, but it was all the neurological soft signs were coming on. There was just changes not only within his scans, but you could just see some of these they're subtle and they're kind of the basic physiological functions of the body. But when the body gets steamrolled like that and you have, rampant inflammation, that's what Lyme's will do. When you have rampant inflammation, the body doesn't just go into a stress pattern. The body goes into a bogged down, exhausted pattern. He was
still trying to play baseball.
Oh, it was wild.
He was a mess.
He was a mess.
He was just nowhere.
He would have been an intensive case if we were doing intensives at the time, right? And go through
probably
it.
Would have been faster.
Yeah, and that's kind of where I was going.
Recovery
it would have been faster because when you see those neurological soft signs, when you see your kiddos start to sleep better, when you see them start to digest better, when you see them start to just move better, you're like, oh well, these are good signs. Those are hugely important signs of progress to get to the big stuff later on. Awesome. And now today, Connor is
wellness. He gets adjusted once a week from all of the things he does to his body playing sports. But he's a baseball player. He's a freshman in high school. He's way taller than me now. He's just thriving. And
yeah, he's a dude. He's going pro, and he's going to take his pediatric chiropractor home. I told him.
Awesome.
I told him, man, and I want an air conditioned box. I'm not, don't put me out in the sun.
The teenage fluffy hair.
He does. We call it. Have I told you this joke yet? I saw a meme on Instagram, and because I have donkeys, and when we were looking at the donkeys, somebody tried to convince us to get alpacas. And actually, did you know that the majority of teenage boy haircuts are what they call the alpaca haircut, where it's all faded. It's all faded up, and then it's this curly flop over. I'm like, once you see it, you can't not see it.
So once Connor was coming, then we all we all moved.
And we'll have to save that for your round 2 podcast episode. But you've had quite a healing journey yourself, my friend. Yeah, neither you and I had Lyme's. Neither of us have escaped our own specialties, have we? And needed to go get our own care, which is awesome. Which I think is God's journey to make us even more resilient. And that was my word of the day. And as to you. You're the toughest provider I know to send these kids to. And I say that with the most love and respect and effectiveness to it, because through your experience, not just as a provider, but even with Connor and even with yourself, you just know that healing is possible even against the toughest of cases. So, okay.
Absolutely.
So when it comes to finding, you're not going to like this question.
Okay.
When it comes to finding a provider in your specialty for tough, complex cases, I know we don't currently have a directory and a website that we can say right now.
So just for PT.
It's coming. I'm working on her, everybody. I'm working on her.
Oh boy.
So what are the tips though? What kind of questions if somebody, well, first off, you got to look for, put the two together. You're not looking for just a conventional, just like we tell people, okay, we can often get you to a conventional chiropractor and then we could train them and turn them into a nervous system focus. Yeah. In your world, they'd have to be at a barn, right? You have to put this together. Yeah. So start there. And then what else? What questions should they look for?
Obviously, I think the horse is magical and it sets us apart.
The hippotherapy for sure.
But, there are a lot of really great therapists that work in clinics. I think personally, that going somewhere where there's a team of therapists will right off the bat start you'll know that they're working together, that they have each other to work with. I think it's so important, even especially as a new grad, but as a therapist, like there are a lot of therapists that work on their own, and I'm sure they're, some of them are great. But if you have a team to work with, that collaboration, even within the clinic, changes everything. If you can talk about your kids with each other and from a multidisciplinary approach, and even just other PTs, like I can talk to my other PTs about my kids and my approach, and they all were my students at one point, so I tend to keep them.
It's crucial.
All three of them were my students. Great move. So there are things that they do that they definitely learned from me, but they also all have their own ways of treating, and I think sometimes it's just really nice to be able to collaborate with each other. So not only finding a clinic that has multiple disciplines and has multiple therapists, just because I think it's just so much better for the therapist to have learned from each other and learned from within a team, but also a therapist that's willing to work with your team, a therapist that's willing to work in collaboration with you, with your chiropractor, with your pediatrician, with, any of your other providers, even if you're seeing different therapists at different clinics, that they're willing to work with each other. Obviously there's a feel to how, your personality meshes with another therapist's personality. And I think some families, it's okay to not like your therapist. It's okay to want to switch. It's okay to look for someone else. You don't have to stick with the first person that you see by any means, but finding someone that will collaborate, with other therapists, but also with your own team, especially with the chiropractor. And I think obviously that's something that you always have pushed and wanted me to do. That's not the easiest thing. I don't think we haven't had a lot of success finding that other places.
Right.
We're very lucky here in this little community, and I think we've developed it. We've definitely worked hard for it. We've made it happen, but we're also really lucky in this little town of Crystal Lake that we have these
it's across the board,
these relationships
from Jessica and the well-rooted team.
Absolutely.
And so actually let's go there. That's a perfect closing. That's a closing call to action. And you know what? I know these moms, I know these dads, and I know these professionals that are gonna hear this message. And some of you are gonna do this because this is just how God made you. You are GSDers, which means get stuff. You thought I was going to swear on the podcast. Get stuff done. People extraordinaire. And so just the other day, just last week, we had more intensives come. I sent the one to you. We were talking about, they're like, and it's another guy. And he's like, how did you even, how did this, he asked the question, the dad, like, how the heck are all of these amazing, not only trained people, but experienced people.
And the fact that we all work together so well.
And that's what he said. And he goes, you're telling me like you all have been collaborating for this long? And he goes, how did that just randomly happen? And I in the moment, because I think I was just focused on the case, I was like, yeah, pretty random, pretty crazy, huh? And then I was preparing for today's podcast episode, and even us talking beforehand, just kind of going back through our own story. And I was like, you know what? This is God directed, like everything, always, but we made it happen. We've all been busy as parents and providers from the beginning, but we did meetups.
Me and Jess all sat next to each other at Duke's at a dinner that you had with a lot of other people in the community. I don't remember who else was there. I remember one speech therapist that was there. I don't even remember who else was there, but I know we all sat in the corner together. That was way before. It was right when Jess opened her practice. And
we were doing that even before we got Jess to awesomely open up that practice. Yeah. We were doing that from this standpoint, And so the call to action here is twofold. The first one is the one that we talk about all the time. And Beth I love it when Beth says it because back to the story of like, for whatever reason, PTs graduate with kind of this like angst against chiropractors and chiropractors graduate. And it has no basis, by the way. In fact, the only basis we have is, holy cow, this works great together. Stay in your lane. Like, why does everybody want to be everything I don't. You don't want to be.
Not at all.
The worst thing to be is to have a provider who's a jack of all trades. If your chiropractor is adjusting, doing nutritional counseling, working on primitive reflexes, shining lasers at your kid's head, if they're doing 17 things, it means, and I'm just, goodness, am I saying it? I can't not say it now. If they're doing 17 things, it means they're not really that good at any of them. Okay. When you get really, 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 really really good at one thing, you got no margin to do anything else. You need a Rolodex. You need your homies. You need your Beth. You need your Jess.
Absolutely.
And say, hey, you're the expert. You're the wizard at this. These kids I care for need this. Can we collaborate? So number one, if you have everything else, if you have your therapy team, first off, take this podcast episode and go, okay, do I have the therapist that I really, really, really need for my kiddos? Second, do I have the full team? Who am I missing? Am I missing the PX doctor? If this is the first time you're finding this, go to the website, go to the directory, get connected. That could be the missing link that honestly, ready state. That is what gets your child to see so much more responses with movement-based therapies, with functional medicine. So you may be missing, most families are, we're working on it, but they're missing that, the neurologically-focused chiropractor. And the final call to action, for those of you that this hits you right in that mom and dad gut, you start the community in your county. You host the meetup. We did it. We didn't even know what we were doing. We had no idea that God would have Levi call us. Shout out to Levi and Megan and those amazing folks. But we didn't know, but we kind of knew. Right? We kind of must have known that we needed to be ready.
And don't stop trying to do that. We tried for years, and then we would just get so busy, it would actually not happen. And then it really was Levi's story. We already had a meeting on the books. You were coming to meet with us at another provider's brand new clinic here in town, and there was 4 of us, and we met up, and you walked in, and you had just gotten off the phone with Levi's mom, and and
I think I said help.
You did. You said help.
Yeah.
I said, we did it together, and
wasn't that crazy? God's timing, that meeting, which we had been looking to do for years. If you don't think God works wonders to make these things happen, we had been trying to get that meeting. Denise, Jessica, me, and you. I think Javier was there then too.
Yeah.
For years. And the night it finally happens is the night before and the day of is when the toughest case we've ever seen comes. So guys, you're the tough ones. You're the resilient. Somebody connect your providers. Okay. Parents listening, you might have 3 providers right now who you're like, I got a Tony, I got a Beth, and I got a Jess. They don't know each other. Moms listening, be the ringleader. Be the meetup. Yep.
Collaboration is key. The power of what we can do individually is great, but what we can do together is so much more impactful. And if we can create that at other places, that would be amazing. Yep. So definitely go out and connect those people. I think that's super important in your child's care, is that collaborative effort by the whole team. They all need to be working together. Yep.
So going forward, just because the action is the most important, let me run through the list one more time. So go find your Beth. That's how we say it, right? I know you don't like it. It's like when people go find your, I don't get it, but I get to say it to you. So sorry.
Well, at least there's a lot more PX docs.
Yes. So around, true. So find your Beth. Really look for a hippotherapy, an experienced collaborative. I love the tips you gave about finding. I would double tap on that. Absolutely find a therapy team that is there and do it that way. Number 2, find your PX doctor if you don't yet have it. Number 3, be the connector, be the collaborator, bring those professionals together. Hey, be selfish, because guess what? That's better for your kid to get them talking. And if it's better for your kid, it's better for hundreds and then soon thousands of kids in your community. So be the connector. And then last thing, as always, I got to ask this, please be the connector for us from this podcast to tons of other moms. Send this to your providers. Send this to your therapy team. Send this to your doctors. Send this to the other moms. These are the conversations that are going to change the world, because we're all so busy. We're siloed and we don't even know we are. And everything changes when the collaboration happens. I don't know that there'll be a more impactful podcast episode than this one, because there's not enough people talking about collaboration amongst providers, because there's simply not enough people doing collaboration. So if you're not doing it, you're not talking about it, and we need to change that yesterday. So moms, help us do it. Share this episode especially with as many of all the providers on your team, and share it with all the moms you know who are like, if I could just get my PT, talking to my chiro, talking to my nurse practitioner, talking to my neurologist, guess what? We talk all day, every day, because the only thing that does is it gets your kids better. And we wake up thinking about doing that. We go to sleep doing that.
5:30 in the morning.
It is,
sometimes.
I do text you early sometimes, and I love it. You're always ready for it, for sure. I don't want to forget. I'm
the same way.
Mid-40s now. The forgetting happens pretty quick.
That communication doesn't take that much time. It's just, it needs to get started.
It does. All right, everybody. Miss Beth, will you come back and jam with us again one time and just keep this as a regular contributor? Perfect. All right, everybody. Thank you for listening. As always, remember, we are here. We are bringing you like no podcast, no platform anywhere. Hope, answers, and drug-free action steps to get your kiddo better. We'll see you on the next one.